Episode number 226 of the Wholesome Fertility Podcast. My guest today is Sharon Fisher. Sharon is a board-certified psychiatric nurse practitioner with additional certification in perinatal mental health through Postpartum Support International. She founded Nurtured Well, a boutique women's mental health practice in Maryland. After a long fertility journey, Sharon felt driven to help other women struggling to conceive. She's also the co-author of Beyond the Egg Timer, a companion guide for having babies in your mid-30s and older. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. Welcome to the podcast, Sharon.
Thank you. I'm glad to be here.
I would love for you to share your background with the listeners.
So my name is Sharon Fisher. I'm a psychiatric nurse practitioner, and I'm the co-author of the book Beyond the Egg Timer, a companion guide for having babies in your mid-30s and older. And this was a passion project that I co-authored with my good friend, Emma Williams. And it was born out of our own experience having babies after the age of 35. And at the time we were having kids, there was so much misinformation. There still is a lot of misinformation, but it was even like a million times worse. And a lot of shaming. And it felt very, most of the people we knew had kids over 35 and didn't really have any issues. And we also knew that it was much more nuanced and complex than simply waiting too long. So we wrote the book out of that. And then I also have founded a women's mental health practice here in Towson, Maryland. That was really inspired by my experiences going through infertility and then pregnancy and just dealing with all the postpartum stuff and now moving into perimenopause. So all the aspects of adult women's lives.
Yeah, for sure. I mean, I hear so many stories from my patients and my clients. So many, and some of them I've actually had, they've wanted to come on the podcast to share their stories. And one of them was told, from two different doctors that she basically can't get pregnant on her own. And when she did actually get pregnant, then she had to deal with the whole, you're approaching 40. She was getting close to 40. It's high risk and all of these things. And she ended up really advocating for herself and having not just one, but she had two healthy pregnancies, and advocated and had the birth how she wanted, waited, didn't induce like they pressured her to. And it's interesting how people get put into a category. There's numbers and categories, and everybody's just placed in that category. It doesn't matter who you are, how your body is. It doesn't matter. Everybody gets put in that same category, and people get very frustrated because it feels like they're kind of put into the system and nobody's really hearing them.
Well, right. And especially with pregnancy, it pathologizes something that's not an illness or a pathology, unless, if God forbid, you're that very small percentage that it truly is a high risk situation. But for most women, whatever age they are, it's not. It's just a natural life process.
Right. And then after 35, 35 is like the time. They call it a geriatric pregnancy, which to me is just crazy.
Yeah, I found it hilarious. I had my kids at 38 and 40. I was a month shy of 41 when I had my second one. And I just thought it was so hilarious because it's like, yeah, no, I'm really feel like I'm at my prime.
Totally.
So,
how did you approach this with your clients to help them overcome like all of the different labels that people are up against?
Right. So I think the first step, right, is to really get good, unbiased information, just factual information. And I really advocate for my clients to find that for themselves, because I think it's all about full and informed consent. So if your provider is saying, yeah, we want to induce by 38 weeks or 39 weeks, really ask them for the statistics, right? and ask them. I always believe in absolute risk, not relative risk, because the relative risks do often look scary.
Mm-hmm.
But when you actually look at what that translates in numbers, it's still so rare that these things happen. And so really, and asking the how come, in a non-adversarial way, just how come you want to do this? How come you want to order this test? How come you want to, and just have them reason through it, because oftentimes, and this is something that should be done, ideally at the beginning of the pregnancy when you're interviewing providers, and also understanding that you have a choice. This isn't even though the pregnancy is unplanned, you usually have between 6 and 9 months to figure out what you're doing in terms of your delivery. So I think, right, getting that piece, that education piece, and advocating and getting good, solid information on what is risky and what is not. And then I think really thinking through and processing, how come you're having children at this age versus not a different age? And for some women, they're very comfortable with that. The whole there isn't a problem at all. They don't see it as a problem. But for some of the women I work with, they really do. Like they feel out of step with things, or somehow they're not following the pattern that we're supposed to follow, and really helping people identify what their values are and how they're living life in accordance with those values. And ultimately, I think trying to be as stable emotionally, mentally, financially as possible before having a baby really speaks volumes to how much you actually value motherhood and value children. And so having people, make peace with that, I think is really helpful. I think also talking a lot about where does your image of motherhood come from? What form that? And what makes a good mother? And oftentimes, if we think about, most people will say what makes a good mother is, I want to be nurturing, loving, supportive of my children, expose them to things. But an age really has nothing to do with any of that.
Mm-hmm. Right.
It really, you can't, you can argue, right, that there's an age where you're more loving. That just doesn't even make sense. And I think some people get caught up in, how will I look compared to, and I probably only had a few clients feel this way, but what I see in the larger community when this is discussed in forums, or I just hear people discussing it, how am I going to fit in or compare to the other moms? And I think that's a much deeper issue than your age. I think if that's where you're at and you're still sort of caught up in that fitting in or keeping up with the Joneses type mentality, then that's probably a much bigger issue that probably affects many aspects of your life, not just parenting. Some people get very concerned about their energy level, and I always remind people it's you compared to you. So it's not that all 40-year-old women are less energetic than 20-year-old women. It's you probably do have less energy than you did when you were 20, but your energy level at 40 might still be higher than somebody else's at 30.
Right.
Just like wisdom, hopefully you're wiser now, but that doesn't mean that all 40-year-old women are wiser than 20-year-old women. It simply means that hopefully you're wiser than you were when you were younger. So it's always just about you. And if you do have less energy, you probably have more resources, such as money to, have meal delivery kits or things like that take, some of the energy demanding things out of our life, where you can focus more on your kids.
So what type of clients do you usually see in your practice? Like what ranges of ages or?
Sure. So we see women age 18 and older. There's no real upper age cutoff, although none of my clinicians, I have a group of 3 clinicians, myself, another psychiatric nurse practitioner, and a social worker therapist. None of us are experts in geriatrics. So we do usually recommend that after say 70 or so, it's better to see somebody who specializes in that. Mm-hmm. But people come to us with depression, anxiety, bipolar, ADHD. A lot of people will come to us for preconception consults if they are on psychiatric medication, to really learn and understand, because that's another thing that is so terribly misunderstood, but really understand the risks of certain medications, the risks of not being on medication, and how to get through the pregnancy as healthy as possible, along with other factors you might need to consider. So, for example, we all know sleep is super important for everybody's mental health, whether you have official diagnoses or not. But there are certain conditions such as bipolar, where if you go too long without sleep, it really can trigger a manic episode. So we start to plan for that. How can we protect your sleep? And maybe that means, if you plan on breastfeeding, which is awesome, it might mean that you have to work into pumping so your partner can do the night feeding, so you can get like a 5-hour chunk. I was going to say 5 or 6 hour chunk. Whatever gets 6 hours with a newborn, but to get the longest possible chunk as possible of sleep. So yeah, I hope that answers your question. And of course we get a lot of people.
I wanted to know, like, more specifically for fertility, like what are some of the common stories that you hear, or the common challenges that people are facing when it comes to trying to conceive, and like how they see themselves? And because the other day I was actually thinking about, like, shame is a big thing for a lot of people going through fertility challenges, and like the things that people tell themselves about what is happening, and it's really not in their hands. It's not something that they can control. It's something that they're trying to control. So what are some of the more common situations that you see?
So yeah, usually see a ton of anxiety around it. And oftentimes they're women who've had losses. And so there's like even more anxiety.
Yeah.
I see a lot of anger. Like, why does everybody else get to have a baby? And then a lot of shame around the anger. We call that a meta emotion. So how you feeling about your feeling, which often feel even worse because nobody feels good about their feelings usually. So feeling anger and then feeling shame that you're angry, feeling resentful and then feeling shame that you're resentful, and really normalizing that. And also a lot of boundary setting. What I've seen, and this is not, an official huge study, but just in my experience anecdotally, is a lot of times the women who really struggle with fertility are the ones that have had terrible boundaries their whole life and have given away so much energy. And I think it can be a really great opportunity, to really start setting those boundaries. And feeling okay with that, really giving permission that you don't have to be running around going to all these places you're invited to, doing all these different things. You really can just stay home and rest up. You can take care of yourself and create that space for that baby to come.
That's such a good point that you mentioned. And I actually had a conversation with somebody about this, because in Chinese medicine, the emotions can really impact your organs and your energy physically. And it takes a lot of energy to conceive. So if you're giving away your energy in any capacity, then it's being sacrificed, like the energy that for your body. I mean, we've all felt it when we've been in really draining situations. We come home and we're zonked, whether it's at work or with really difficult people in our lives, or like anything like that. It can really zonk us out. And that energy is leaving your body to go somewhere else. And that ultimately, really for reproductive health or even overall health, you need energy.
Absolutely. Absolutely. So I think it's really important to give women permission to focus on that.
Yeah, for sure. And as you mentioned also medication, which I think is really important to talk about. So people going through severe depression, I know that there's certain types of SSRIs, but then some of them are okay, right? I mean, is there like some that are in the category that aren't great?
Oh, pretty much all SSRIs at this point are considered okay.
Oh, they are. Okay, that's good.
Yeah.
That's good to know.
When we look at like, how do we understand we're always looking at the risk of the medication versus the risk of the disease, because the disease itself has risks too. And somebody who has moderate to severe depression is going to have a higher rate of miscarriage, is going to have a higher difficulty conceiving. We know because of how, if we think about the hypothalamic pituitary adrenal axis and all the stress hormones going, then it starts to reduce oxygen to the placenta and causes other stress reactions. And the baby's feeling all that. And so then we think about other, just, we could spend hours thinking about it, but if you're depressed and you stop going to work, and then you end up impoverished, or you're depressed and it causes all this interpersonal conflict and your marriage falls apart. They're all the ways, right? And so what we know is, no medicine is totally risk-free, but we know that SSRIs do not cause miscarriage. We know they do not cause birth defects. There is a very, very small increase in pulmonary hypertension in the baby, but it goes from like 1 in 1,000 chance up to like 2 in 2,000 chance if you're on an SSRI. So it's still like, and that's a great example of absolute risk versus relative risk, because the relative risk sounds, oh my God, twice as likely, but the absolute risk is still 2 in 2,000, not something I'd spend any time worrying about. Especially when we start to think about what would be the risks of not treating moderate to severe depression with medication. Somebody with mild depression is probably better off doing psychotherapy and other lifestyle changes, not because SSRIs are bad, but why expose a baby to anything that you don't have to expose a baby to? And we all know that these medicines have side effects in the person taking them too. So like, why take a pill if there's other things you can do, right? And so, but back to your question. So obviously we don't do randomized controlled trials in pregnant humans. So we have to look at retrospective data. And the more years we have to look at it, the more we're seeing they're all safe. Some SSRIs are just not used as often as other ones. And so that's why the data was sort of lacking. But then the more that comes out. So that's good news for somebody with moderate to severe. But I'm always a huge advocate as somebody who prescribes these medicines, is that they don't work in isolation. Having therapy, having good lifestyle skills, good nutrition, solid sleep, things like acupuncture are so helpful. Reiki, massage, if that's accessible to somebody, of course, exercise, all the things. A pill doesn't cure anything. It gets you well enough to do some of these other things.
So you're saying try everything else first and then see, unless it's like really, really severe, then it's a different story. You might need something a little stronger, but really try other ways before going to the pill.
If you have mild depression, if you have moderate to severe depression, then I would start with the pill, because it's going to take time for those other things to work, and they may not work alone. You may be somebody who needs an SSRI for sure.
Right. And if you have mild depression, what type of therapies have you seen being really helpful? You mentioned acupuncture, other things, but cognitive, I know that there's like different types of therapies out there.
Yeah, so cognitive behavior therapy has probably the most studied data on it, because it's sort of hard to study these things, but that can be really helpful because it's usually works pretty like quickly. Usually within like 8 to 12 sessions, people are feeling a lot better. But they often say like, the best therapy is the one where you feel the best relationship with the therapist. And so often, I think they can all be good, but things like CBT, things like ACT, acceptance and commitment therapy, they all are very tool-based. And so they're very active in the session. It's not just sitting feedback. You're really working on things, and you usually get tools that you have to practice during the week. And that helps, because it's sort of like, if you're going to just, work out once a week at the gym and never do anything at home, you're not going to get in shape. And it's the same kind. So yeah, I often look at stuff like that, especially because we understand the biggest predictor of postpartum depression is how you're feeling mood-wise during pregnancy. So we want to get you as well as you can be as quickly as possible. And I think when people are trying to conceive, I absolutely think it's so important to have the support of a therapist, because it's such a charged topic, and people don't understand, and they mean well, and they say crazy things and hurtful things, but they mean well. So to have somebody who can really help you process it. I'm also a huge fan of the support groups. Resolve, the National Infertility Association, runs peer support groups. I think they can be really helpful normalizing it, because back to how you view it, there's such, this is something we're programmed biologically to be able to do. And when we can't do it, there's so much shame. And it can really wreck how we think of ourselves, how we define what being a woman or being a man is, what we believe in just about the world. And it can make you feel really unworthy in a lot of ways, and finding ways to work through that. And also, I bought my kids this book when they were interested in learning about where babies come from. And it's called What Makes a Baby. And I love it because it's not like there's a man and he makes sperm, and there's a woman and she has ovaries. It's just some people are born with ovaries and some people are born with a uterus and some people are born with sperm. And it leaves it all open to interpretation. And the pitches are these just sort of amorphous blob type creatures. They're not male or female. They're like purple and green and circular. And I love it. I don't know the original intention the authors had. It's certainly wonderful for people who are like non-binary or conceive maybe, well, yeah. But I love it as somebody who went through infertility, that it doesn't correlate being able to have a baby with being a woman, or, having, we did end up using our own genetic material and everything, but for somebody who might have to use like a gamete donor, having sperm as being a man or something, like it just takes that part away. It's like some people have these things and some people don't. And I love that about it. And then it also leaves up to the adult to explain, they say, well, at some point the sperm and egg need to get together and they need to get into the uterus, but it leaves it up to the adult to explain that to the child, which is a wonderful window for children who were conceived through artificial reproductive technology, to really normalize that.
Right. Yeah. There's so many different ways we can do things, right?
Yeah. Yeah. And it takes it away from that. What starts with breaking down the shame, taking that away. Like, I'm not less of a person because I can't biologically have a child.
Yes.
It's just,
Absolutely. And I find that the validation aspect of it is huge. I think it's very healing. Not just that, also what you were saying about being in community and having other people with the same stories that you can actually relate to, because I think that that's a very big key, is that we're social animals. We really like to feel part of the tribe. And then when we feel like we're the only ones that are not like everybody else, it's very lonely and you feel like something's wrong. And then when you find other people that are going through what you're going through, you get back that feeling of belonging, and it can be very healing.
Absolutely. And that's why we wrote the book, as well, because what we wanted to, at a big level, really validate the experience of having a child over 35. And not all the women in our book had fertility issues. We interviewed a bunch of different women and stopped interviewing when the stories started to repeat themselves. But we were able to draw out three themes. And one was infertility, people like myself who started under the age of 35, but it just took so long. I ended up being 38. People who were indecisive about having children and really wanted to be sure about it. And that group gets a lot of shade. They get a lot of shade thrown at them because it's considered selfish. Yeah, and it's not. It's actually the most selfless thing, because you're really making sure you want to do this parenting thing. You're really all in. You're going to do it. And then people who just, life happened that way. And that, that just whatever, maybe they got divorced. They didn't plan on getting divorced. They got divorced. It took a while to meet somebody new, or, they I don't know, economy crashed. And so, they afford a child. But we wanted to create that community and that validation that having a baby over 35, first of all, there's tons of women doing it. Throughout millennia, there is always women doing it, because if you lived long enough, you were going to have babies till you hit menopause. And that it doesn't make you selfish or career crazy or any of these things. It just is how your life unfolds. And we, have these narratives of these different women who people can really relate to. They're all different, so somebody can always find something to relate to in at least one of them. But just, this is how life is, and you didn't do anything wrong. It's okay. And all of they're all real first person narratives that everybody ends up with a baby. And so it's very hopeful.
Oh, for sure. When you read other people's stories and then you find similarities for what you're going through. And what tips would you have for somebody if they are going through challenges? What kind of things would you recommend for them to do, as far as like either journaling or just like asking themselves questions to help them understand or overcome like certain beliefs that might actually be holding them back?
Yeah, that's such a great question, right? What are the beliefs that are holding you back? What are the beliefs that are holding you back? So I think that whatever age you are, if you're going through fertility treatment, first, I would really step back and choose. Well, in the book, we actually have a guide, like how to how to judge what's working for you or not working for you, which is really great. And I should have pulled one up here, but essentially, I think first getting all the accurate information. So oftentimes I'll hear people, like I was once at a party and this woman was talking to me. She knew we were having fertility challenges and I was working on the book and everything. And she's like, yeah, we tried. And I guess I'm just too old. And I'm like, well, how old are you, if you don't mind me asking? And she's like, I'm 37.
Mm-hmm.
And I'm like, no, not at all. Her husband was 50. And I'm like, you might want to get him tested. There's a much greater chance that at 50, his sperm aren't doing what they need to be doing. But get the information. And then, we can't afford a fertility center. Well, in the state of Maryland, where we were at that point in time, all insurances had to cover at least a fertility evaluation. Now they have to cover treatment, which is awesome, but they had to cover at least the evaluation. So again, inaccurate information. You shut the door before you even had a chance to look at what's out.
Point. Yeah.
Right. Because then I said in the evaluation, even if a lot of things they find can be fixed, in quotes, your listeners can't hear that, for medical reasons. So even if you don't have fertility coverage, if say you have endometriosis, well, you might be missing a day of work each month because you're in so much pain. That needs to be treated whether you need kids or not, whether you want kids or not. That needs to be treated, right? If you have PCOS, that should be treated whether you want kids or not. And those could be issues interfering with the fertility. And if it's not that, and it's something that really does need like actual, at least you have the information, you know what you're working with. And then also looking at Western medicine is just one way to go. I utilize a lot of Chinese medicine, and I think finding what you're comfortable with. I did acupuncture, I did Chinese herbs, I did a ton of yoga, specific like for fertility. And I think, first of all, getting the information, why is this? And I don't like using the word infertility. I like using the word fertility.
I don't like it either.
Yeah, because it's not very accurate. It's just an insurance. It's just like
I agree. And it just, it makes people feel identified with something that's not true. And that could definitely hold you back, I feel like.
Absolutely. Right. Because if we think about like law of attraction, right, and we think about the energy you're putting out there, if it's in our head, oh, I'm infertile, then nothing's ever going to work. If it's in your head, well, I'm very fertile, then everything's going to work, right? You're going to have a baby and your garden's going to grow and your bank account's going to grow and all these things because you're going out there. So I think looking at what are all my options and how can I maximize my health, because your best pregnancy outcomes are when you're at your best health. And so thinking about it that way. So I think stepping back, what's all the information here? What is actually the problem, in quotes, if there is a problem, or maybe you're just slower. Oh yeah, it was back to my whole thing, is that's just a designation, but very few couples are truly infertile. If you have ovaries, a uterus, and sperm, then the likelihood that you're truly, truly infertile is probably not there, but it might be such a long process that you want to speed it up, right? Or if you definitely know you want to be a parent, you don't want to take any sort of risks on just waiting and waiting and waiting, although some people might, right? But then looking at, what are my options? Do I have to just I get very tense when clients come in and say, yeah, we haven't conceived in 6 months, so we're going to start IUIs, and then we're going to do medicated, and then we're going to do IVF. And it's like, whoa, calm down. Because couples between 35 and 40, 80% will conceive within a year. So maybe you need more than the 6 months. And if you want to start all this stuff at 6 months, great. I'm not here to judge you. I just want you to have full and informed consent about it.
Yeah.
So then, right, like if you pick out what you want to do, like I did, for example, we were very slow to actually go to like a Western fertility clinic. We started with all the other stuff. So I was doing acupuncture, and at one point they wanted me to come 3 times a week and like actually writing out like, how is this feeling? And at first it felt great. And then it felt too much. I felt too pressured. Okay. So let me walk it back to once a week. Oh, that feels good. I was doing these Chinese herbs that you had to like boil. I made them in like my crock pot, but like they smelled terrible.
Yeah.
So like that's making my husband really angry. And I'm like, okay, well, an angry husband's not going to help you conceive. Let me like reevaluate this. And so I cooked them on my back porch. Problem solved. So I think the point of what I'm trying to make in a long-winded way is get your information about not only what your status is, but then what are all your options. and then keep a log. This is what I'm doing on this date. This is how it feels. This is, any notes about it. And then you can refer back, because when you're in something, it's really hard to see it. When you're in the storm, you can't see it. But if you look back and say like, okay, I was doing that 6-week yoga series, and, when you wrote it down, oh God, you just felt great all the time. And then it ended and you switch to something else and you're not feeling so great. You look back, oh, wait, yeah, I actually felt really good doing yoga. So then you sign back up for that. And the same thing, like there's something about, I go straight to the IUIs. Okay, then write that down. And how did you feel doing that? I think that's helpful. I think getting as much support as you can, crossing out things that aren't important so you're not giving your energy away. And I think doing a lot of mindfulness practices, because when you go through infertility and you're triggered left and right? It's the age where everybody's pregnant. And so the more tools you have when that colleague comes up to you and says, guess what, I'm pregnant, that so you don't just burst into tears. Not that there's anything wrong with that. People don't want to do that. So the more you can ground yourself and steady yourself, the easier it's going to be. And that doesn't mean you can't cry about that later, but just giving yourself some tools to hold steady. And I think that if you have a partner, really making sure that you're continuing to connect with your partner during this time. And what I often see a lot too is conflict in my practice, conflict between partners about how to proceed. And so that's, you want to create as much closeness, not space. And so really finding ways to communicate how you're feeling about things and why you want to go this direction. And also truly hearing their concerns if they're not traveling at the same pace you are, because you don't want to give up you don't want to stall or give up there has to be a compromise. And that's how you're handling this is just the beginning of your parenting journey. Because if you can't work on this together and it create closeness and richness, then parenting together is going to be really hard, because it's very challenging. And so it can just be a wonderful opportunity to grow the relationship, but it doesn't do it naturally. You've got to put the work in.
That is such a good point that you bring up, because I think that people who are trying to conceive, they look at the before aspect and they're like, okay, once I have this, everything's going to be great. And, and yes, it is. But a lot of what you're doing earlier is really important, because it can impact also what's going to happen after. The after also needs attention, because you're going to need to work together with your partner. It's really important. So there are a lot of things that people actually find that they benefit with, like even just clean living and learning about that, because you're going to be passing that on to your kids, and you're going to be using better products and keeping the house toxin free. All of these things are going to be things that will impact, because I think that sometimes there's this disconnect of like the after, because it's almost like I just want to get to this point, and then there's kind of like not much thought sometimes in the after until like later on.
I'm so glad we're talking about this, because that made me think too of postpartum depression and anxiety in women who've had a struggle with infertility. Oftentimes there's this thought that, well, two scenarios. One, if they develop something like postpartum depression or anxiety, they feel tremendous guilt, but I wanted this. And so really explaining to them, this has nothing to do with how much you love your kid or wanted your pregnancy or not. This is major hormonal shifts causing this. This is sleep deprivation causing this. And it's no reflection on your worth as a mother or how much you love your kids. And then the other thing that I see that's less severe is if they're not loving every minute, and it's like, well, nobody loves every minute of anything. Like
that's true. That's so true.
We love every minute. Right? So like, it's okay.
Expectations, that we upon ourselves.
But I will say what I've found in my practice with the women I work with is that they're generally, the longer the fertility journey, like the longer the challenge, the sweeter the reward, because these women really do respond great to motherhood usually. And what I've seen, and I experience this myself, but I see it in my clients too, we weather the storms of parenting much easier. Like we're not flipping out because the kid drew on the wall, because we understand what it's like to have the real reality of not being able to have a child. And so it's not that we're not annoyed, because
Such a
everybody
good
gets annoyed.
point. Yeah.
But we're not flipping out. We're able to go with the flow a little bit more, because there's this level of gratitude. I often compare it to, hopefully everybody feels grateful for their kids, but I compare it to a home. I'm grateful for having a home. I'm really grateful for having a home, but I could never have the level of gratitude for having a home as for somebody who is actually homeless. Right. I've never been threatened with homelessness in my life. So for somebody who's actually like lived on the streets and then they get a home, I don't care how grateful I am, they're like a million times more grateful. And I think it's the same thing. Like, yeah, you can be very grateful for your child, but if you got pregnant easily and had, no normal delivery and everything, then you just can't know the level of gratitude somebody that it took 3 years to get pregnant, or somebody that had 5 losses before their pregnancy. You just can't touch that. And I think that gratitude then filters down to how you parent, and how you can just be a little easier, you're just not as uptight. And then I also work a lot with my clients on just accepting the uncertainty of life, because that's the biggest, scariest thing for people who've had going through infertility. Like, will these treatments work? Will they not? Especially if they've had losses, and really helping them understand you have to embrace the uncertainty, because you can worry and worry and worry until you get that healthy baby in your arms. But then let me tell you something, the worry is not going to go anywhere. Then you're going to be worried about SIDS. And then you're going to be worried about they're in preschool and I don't know, something happens. And you're worried about them driving. So get used to it now and learn how to live with the worry, because worry is a normal part of life, but we have to learn how to live with it. And we have a lot of coping techniques in our book as well. Just different breathing techniques, meditation techniques, and just ways to live your best life while you're trying to conceive.
Awesome. Well, this is amazing information, Sharon, and I could definitely talk to you for hours, because the mind also, like just how we perceive life, and the mind realm is so interesting to me, and how emotions impact people and behaviors. And I think what you've shared was really great information. And so for people who are interested in the book or wanted to reach out to you, how can people find you?
Great. Thank you. So the book is on Amazon. It's called Beyond the Egg Timer, a companion guide for having babies in your mid-30s and older. And you can get Kindle or a soft cover. And then my practice is called Nurtured Well. We serve women throughout all of Maryland and Washington, D.C., either telehealth or in person. And you can go to our website. It's nurtured, NURTURED well.com. And you can find me there. I'm also I'm on Instagram at beyond_the_egg_timer. And I'm trying to be a better Instagram poster. So the more people who follow me, the more I will actually post. I'm getting there. And so thank you so much for having me. It was great talking to you.
Of course. Thank you so much for coming on today. So that concludes today's episode. You can find all of the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to share and leave a review. Reviews mean everything to podcasters, and I really enjoy hearing from my listeners. You can also find me on my website at www.thewholesomelotus.com or email me at info@thewholesomelotus.com. I love hearing from my listeners. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com. I thank you so much for listening in and hope that you have a beautiful day.